When it comes to our observations and visual inspection, we still have our general and then we have our specific visual inspection we need to be doing. And again, all this should be happening as soon as you see your patient. As they're coming into the athletic training room, they're coming off the field, the court, you should be able to notice some of the stuff that's happening. We're going to ask or look for swelling and where that is, determining, kind of where the area is. This might show up too when you ask where their primary complaint is, their one finger, one spot. We want to look for a gross deformity. We want to look for discoloration. We want to look at the skin, see if there's any scars, tumors, cysts, anything that might indicate what's going on. Again, remember your nerve patterns and how, especially with the hands and the fingers, you may notice a lack of hair, which can indicate a nerve injury, nerve issues going on there. So, observing that stuff, the fingernails, right? Looking at if there's clubbing, if there's all kinds of things that you can have with fingernail health that can indicate something that's going on further, as well as just kind of the infections around the nail that we need to be looking for. We want to pay attention to apprehension and shock. If you've got dislocation and fracture type injuries that you're suspecting, you really need to pay attention to apprehension and shock. Don't forget about your crash kits that you carry with you that have things to help you with if your patient should be going into shock. Blankets, you've got bag valve masks in case, all of a sudden they're not breathing. Blood control, all that stuff you should have in that crash kit. We want to look for symmetry, making sure that the left and right sides look the same. And then we want to look at functional loss and see if they're having issues with anything. They can't grip as well on the one side as they can the other, things like that. And sometimes that swelling and the deformity is going to impact the symmetry and the functional loss. So sometimes those get tied in together. When we look at our visual specific side for the wrist, hand, and the fingers, again, the disrobe test is going to pop up because things like buttons and zippers are going to impact, if they have a finger injury, if they're nails. Shoot, I find that my nails get really dry, the skin around my nails get really dry in the wintertime, and I'll get little cuts and sores there, and I hate doing anything because it hurts so bad. So that's going to be a good question to ask them, just in general, how, buttons, zippers, anything of that nature, tying things, how that goes. We do want to look at the carrying angle, specifically the posture of the hand. Remember, everything should be in alignment from our wrist all the way to our fingertips. So, the hand should sit on top of the wrist. The fingers should sit, square. The knuckles, the nails, they should all be in alignment. Nothing should be rotated. If you are seeing that, we need to look into maybe potentially some sort of spiral fracture happening there. We want to look at the continuity of the radius and the ulna, especially the distal part, making sure we don't have any Colles or Smith fracture happening there, though that would be a gross deformity and you would probably pick up on that pretty quickly. We also want to look at the continuity of our carpals and our metacarpals, make sure that they're all, bilaterally compared. We don't have any swelling going on in there or anything funky that would make us think that there's something serious going on there. Our finger alignment, making sure that the knuckles and the nails are all straight, nothing's rotated. And then we also want to look for, if you remember me mentioning in the chapter about Russell's sign and Murphy's sign, I don't know if I mentioned Murphy's sign actually, but Russell's sign is going to be the lacerations on the back of the knuckles from people who are suffering from or have suffered from bulimia nervosa. That would be an indicator, they stick their fingers down their throat. As they're bringing their fingers back out, they scrape their knuckles on the back of their teeth, causing those little abrasions there. And then Murphy's sign is when we're suspecting a metacarpal fracture, we have make a fist, and then we have a depressed knuckle when compared bilaterally, right? So that's going to be a Murphy's sign. So those are two things that are really pretty important to be watching when we're doing our wrist and our hand evaluations.